Today we're here at the Louisiana Marathon Expo, which is the event where people register for the Louisiana Marathon, the Blue Cross Kids Marathon that's happening this weekend. And we're particularly here with our partners, All of Us, which is a program from the National Institutes of Health to build the largest database of health information to make sure that every population within Louisiana and within the country is able to benefit from the great medical research that's happening across our country.
This Plus is a plethora of information. What we want to do is we want to connect people with better options. And how do we do that? We want you to come on board and learn about precision medicine. Precision medicine is looking at you as an individual and getting a solution that's best for you. You're wearing a pair of glasses right now, right? If you were to take those glasses and give it to another person and say, look through these, it wouldn't work as if it did for you, because that specific prescription was made just for you in mind. That's what we do for people. We're also creating the first ever diverse data set so that researchers can have answers to some of those missing variables that have plagued them.
All of Us program is specifically designed to gather health information on different populations that aren't traditionally represented in medical research. So it's been pretty monolithic. People who live right near a major medical facility, for example, are those who've been traditionally participating in medical research. We want to make sure that whether you're African American, male, female, Hispanic, white, from the state of Louisiana or elsewhere, that you're able to benefit from the great things that are happening in medicine today, and having that information on basic health information, genetic information, etc., allows the NIH to allow researchers to do the sort of work that they need to do. And we're partnering with them to make sure that the state of Louisiana, which historically has not been represented in a lot of that research, has its fair share of people participating. And we think that means that they'll, over time, be able to benefit from a lot of those advances in medical science.
The National Institute of Health is the one that's part of this initiative. We are in the forefront of revolutionizing medicine.
Blue Cross's mission is to improve the health and lives of people in the state of Louisiana. As I noted, we see that frequently Louisiana is not represented on medical research. People of Louisiana, with our unique culture and heritage, aren't always represented in the medical information that people are doing research on. So as a result, when a new drug comes out, it might not be as effective on a population like Louisiana. By participating with All of Us, we want to make sure that Louisianians' information is included in that research, that they can try different permutations of medicine to make sure that it helps address the conditions that our folks have. So we're certainly proud to be able to support and partner with them to get the word out of the great work that NIH and All of Us is doing.
Blue Cross Blue Shield is actually part of a consortium of partners, and they're able to reach out in this market because they have a stronger footprint. So each market is slightly different. We're able to utilize their expertise in this market to be able to answer some of the questions that we don't have coming in. Diversity is very important because traditionally 1% of Hispanics are ever part of these research studies, 2% of African Americans. I think we can do better with diversity. I think we can get those numbers up. And what's important on the medical side is they can utilize that information that was missing because traditionally they wouldn't have access to it. And when I say they, researchers.
And what is the final goal of when the research is finished? What is the final goal?
Yep, to find a diverse data set that's 1 million strong, so that genetically we can look at those variables and see how different we are and be able to give researchers those answers. Oh, people are so inquisitive. They're always coming up and they're asking us, well, what is it? Is it free health care? Or can I bring my children on board? So it's sort of like, what exactly is it? So we utilize that to get you in. So yeah, we can show you what it is. You can go on board, you can play games, you can come down, hang out in front of us, in front of the area and ask questions. Blue Cross Blue Shield is here as well. So all of this is to be able to answer questions that normally you wouldn't have someone like us in front to be able to throw it out there.
How can people that are not able to visit the bus in person, how can they participate?
Just go to joinallofus.org/tour. You'll be able to start the process there. It takes about 3 minutes to create a username and a password. The second step is to do consent forms, and that really gets you a very clear picture as to what the program is.
Today's an exceptional day. The Marathon Expo is always a fun time. We've got great partners from all across Louisiana who are here. The folks at All of Us have a nice waiting line of people coming to sign up to learn more. Glad to see it, glad to be a partner in this event.
How can people that are not able to visit the bus in person, how can they participate?
Just go to joinallofus.org/tour. You'll be able to start the process there. It takes about 3 minutes to create a username and a password. The second step is to do consent forms, and that really gets you a very clear picture as to what the program is.
How can people get more information about Blue Cross?
People can get more information about Blue Cross at our website, www.bcbsla.com. And certainly we want to encourage them to find out more about All of Us while they're there.